So our study tried to ask a simple question with do sleep disorder, specifically sleep apnea, insomnia, and COMISA, which is the comorbid insomnia and sleep apnea together, do they increase the risk of type 2 diabetes or not? So we tried to look at fairly young data to make sure we have a clean answer. So we look at 1 million post 9/11 veterans in the VA system who did not have diabetes or pre-diabetes and at their baseline. So those average age of those veterans were 32, and most of them have no comorbidities and no cardiac history. They're young, and then what we did, we followed them. The average follow-up for them was 7.5 years between those patients, and see which one developed diabetes. Again, because this patient is healthy, they're less likely to have other confounders that could explain cause the incidence of diabetes. So we compared three groups: veterans with no sleep disorder, veterans with insomnia only, veterans with sleep apnea only, and veterans with sleep apnea and insomnia together. And the pattern showed a clear gradient. So insomnia carried a moderate risk by like 40% increased risk type 2 diabetes down the line. Sleep apnea was much stronger, almost like 5 times the risk, and COMISA was the highest, 6 times the risk. And all this result is after adjusting for multiple things. We adjust to the weight, we adjust for the socioeconomic status, we adjust for smoking, mental health, PTSD, a lot of factors, like 20 plus factors, and try to adjust to all of them and see if the numbers still hold. And if they did, so the takeaway that is like sleep disorder, all of them, but specifically COMISA, which is the comorbid insomnia OSA, is could be a risk factor for developing type 2 diabetes. And from a side talk, we did run the same data to see if they do increase the risk for pre-diabetes, and we presented that in a different meeting and it showed the same gradient. The numbers were a little bit different, but showed the same thing. Insomnia has increased risk, then OSA, then COMISA. So basically, we ran two studies that showed the same information. So that tells us that maybe whenever we have these sleep disorder, we need to look at them more carefully because there might be a modifiable target to preventing diabetes in the future. Of course, this study doesn't prove that, but it shows there might be a link between them.